Greetings from StudyNeuro again. You finished answering questions 1 through 10 in Part 1. We continue with Part 2 of our 20 must-know brain tumor MCQs in this video. Important genetic and molecular markers, histopathology, diagnostic imaging trends, and clinical management pearls will all be covered. Let's get right to Part 2. Clear, high yield, and clinically related. Question 1. The loss of the short arm of chromosome 1 and the long arm of chromosome 19 is characteristic of A. Astrocytoma, B. Oligodendroglioma, C. Meningioma, D. Meduloblastoma. The correct answer is oligodendroglioma. The combined loss of chromosomal arms 1p and 19q defines this tumor subtype. This molecular signature predicts a better prognosis and greater sensitivity to chemoradiation. Always remember, when you hear 1p/19q co-deletion, think oligodendroglioma and favorable outcome. Question 2. Which tumor is commonly associated with von Hippel-Lindau disease? A. Hemangioma, B. Meningioma, C. Glioma, D. Craniopharyngioma. The correct answer is hemangioblastoma. Von Hippel-Lindau disease is an inherited tumor syndrome caused by mutations in the VHL gene on chromosome 3. It predisposes to multiple vascular tumors, particularly hemangioblastomas of the cerebellum and retina. Patients may also develop renal cell carcinoma and pheochromocytoma. Always remember, VHL disease and cerebellar hemangioblastoma go hand in hand. Question 3. Which is the most radiosensitive brain tumor? A. Meningioma, B. Medulloblastoma, C. Glioblastoma, D. Schwannoma. The correct answer is medulloblastoma. Medulloblastomas are highly radiosensitive tumors, often seen in children and arising in the cerebellum. Because they can spread along cerebral spinal fluid pathways, cranial spinal irradiation is a vital part of their treatment after surgery. This radiosensitivity helps improve survival and disease control. So, whenever you think of a radiosensitive brain tumor, think medulloblastoma. Question 4. Which tumor shows pseudopalisading necrosis histologically? A. Glioblastoma, B. Oligodendroglioma, C. Medulloblastoma, D. Ependymoma. The correct answer is glioblastoma. Pseudopalisading necrosis refers to tumor cells arranged in dense rows around areas of necrosis, a hallmark feature of glioblastoma. It reflects rapid tumor growth and central hypoxia, with viable cells migrating outward. Remember, pseudopalisading necrosis and microvascular proliferation, classic for glioblastoma. Question 5. Perinuclear halos and chicken wire vasculature are typical of A. Astrocytoma, B. Oligodendroglioma, C. Meningioma, D. Ependymoma. The correct answer is oligodendroglioma. These tumors show clear perinuclear halos, creating the classic fried egg appearance, and a fine branching capillary pattern, the so-called chicken wire vasculature. Together, these features define the typical histological look of oligodendroglioma. Question 6. Which brain tumor is most likely to cause hydrocephalus in a child? A. Craniopharyngioma. B. Ependymoma. C. Meningioma. D. Pituitary adenoma. The correct answer is ependymoma. These tumors often arise from the floor of the fourth ventricle, where they can block cerebral spinal fluid flow. This obstruction leads to hydrocephalus, a key presenting feature in affected children. Question 7. Which tumor commonly contains calcification on imaging? A. Oligandroglioma. B. Glioblastoma. C. Medulloblastoma. D. Astrocytoma. The correct answer is oligodendroglioma. These tumors frequently display coarse calcifications, a helpful imaging clue on CT or MRI. Remember, frontal lobe location, perinuclear halos, and calcifications often point toward oligodendroglioma. Question 8. Perfusion MRI helps in A. Measuring bone density, B. Differentiating tumor recurrence from radiation necrosis, C. Detecting skull fractures, D. Identifying calcifications. The correct answer is B. Differentiating tumor recurrence from radiation necrosis. Perfusion MRI measures cerebral blood flow and blood volume. Recurrent tumors show high perfusion because of active blood supply, while radiation necrosis shows low perfusion due to vascular damage. It's an essential imaging tool for follow-up after brain tumor therapy. Question 9. A ring-enhancing lesion on MRI can be seen in all except A. Metastasis, B. Glioblastoma, C. Abscess, D. Meningioma. The correct answer is D. Meningioma. Ring enhancement suggests a necrotic or cystic center with an enhancing rim, a feature seen in metastases, glioblastomas, and abscesses. Meningiomas, however, enhance uniformly and often display a dural tail sign. Question 10. The most important prognostic factor for gliomas is A. Patient's age, B. Histologic grade, C. Tumor size, D. Surgical margin. The correct answer is histologic grade. The grade of a glioma reflects how aggressive the tumor cells appear under the microscope, including mitotic activity, necrosis, and vascular proliferation. Higher grade gliomas carry a much poorer prognosis, while lower grades have slower progression and better outcomes. Remember, when assessing gliomas, the histologic grade is the single most powerful predictor of survival. You have finished answering questions 11 through 20 in Part 2 of our Brain Tumor MCQs series. The link is in the description if you missed Part 1. Check out Brain Tumors Explained in 5 minutes for a brief summary, or watch the entire lecture Overview of Brain Tumors 14 minutes for a more in-depth look. Remember to hit the notification bell, subscribe, and check back for more. Continue to learn and maintain your curiosity.